Next, I'm going to invite Dr. Daniel Huang. Daniel is Assistant Professor of Medicine at National University of Health in Singapore. And we are fortunate to have him here as a visiting scholar. Spent a year and already published 20 papers with us. So we are lucky to have you. And Daniel, all yours.
Thank you for the kind introduction, Dr. Lumba. So today I'll be speaking about the importance of patient cohorts towards improving the management of NASH. So a bit of my background. I'm a transplant hepatologist from the National University Hospital, Singapore. And I think to most people who have not visited Singapore, this is like a summation of what they know about Singapore. So people that all there look good. They live in houses like this, and every day this is our day-to-day scenery. But this is reality. Most of us, myself included, grew up in government housing. But what is real about that show is that the street food is really, really good. And that probably accounts for the 40% prevalence of NASH in our population. How I ended up here, I actually made a visit 4 years ago to some of the leading liver institutes in the United States, and I chose the best. So one of the best decisions I made in my life. And so I'll just today share a bit about some of the work that our team has been doing and how actually patient cohorts that all of you have contributed towards are actually changing clinical practice for patients with NASH across the world. So this study was led by my colleague, Dr. Kim. He was a visiting scholar. He just went back to South Korea. And he utilized this prospective patient cohort developed here at UCSD and looked at the NAFLD score, which is like an MRI-based score that identifies patients with NASH who have significant hardening of the liver. And I think this study, which was just released, shows that this NAFLD score is a really, really great non-invasive way of identifying patients with at-risk NASH. And in the future, some patients may be able to avoid liver biopsy and rely on non-invasive scores. This study was along the same lines by looking at a different question. In this study, we asked, in patients with NASH who are receiving treatment or medication, how can we predict whether their NASH is actually improving or getting worse? And what we looked at here was non-invasive ways to predict how patients may be improving. And in this study, we found that a combination of MRI and simple blood tests may be able to identify patients whose NASH are actually improving based on medication. So we anticipate in the future, perhaps many patients may be able to avoid repeat liver biopsies. We now know that NASH is the fastest growing cause of liver cancer worldwide, not just in the States, but everywhere in the world. And a major gap in knowledge is how we can better identify and screen patients with NASH cirrhosis for liver cancer. So currently, I think the standard of care is ultrasound, but we know that there are major limitations with that. And in this prospective study that was developed right here at UCSD, we found that abbreviated MRI may be a better way to screen patients with NASH cirrhosis. So now I'll switch gears a little and talk about one of our ongoing studies, which some of you may have contributed to. We know that in an individual with fatty liver and liver hardening, his family members, brothers, sisters, or children are at higher risk of having NASH with liver stiffness. But what we do not know is how can we translate this knowledge into actual clinical practice? How can we use a family history of a first-degree relative with liver hardening? How can we use that to screen patients for advanced fibrosis? And so we leverage on a very unique cohort. I think these data are only available here in the NAFLD Research Center. Dr. Lumba has set up a prospective cohort of twin pairs, as well as individuals with and without NASH and their first-degree family members. I think 4 years ago, he collaborated with a colleague at Helsinki, gave them the protocol, and they set up a parallel cohort. And using this very unique cohort, which is not available anywhere else in the world, we developed a NAFLD familial risk score. And so our vision was to use family history of NAFLD with hardening of the liver and combine them with very, very simple and clinically available parameters to then create a very simple score to then identify which of the relatives require screening for NASH. And so we can see that in individuals with a score of 3 or higher, then these patients can be undergo further assessment either through imaging or other non-invasive tests. And those with less than 3 points, they can just monitor their risk factors, exercise, and diet. And this is one way to address the unmet need, how we may risk stratify the population with NASH. So these are just some of the examples of how data from the NAFLD Research Center is being used to answer clinical questions. Every single cohort here is set up specifically to answer an unmet need in clinical practice, and the data from these prospective cohorts are helping to improve the management of patients with NASH across the world. Thank you very much.